So, good morning. Today we are going to another topic on chemotherapy. So, this is a case scenario of Miss X who has attended for a history of increasing dysuria, urinary frequency culminating in urgency that had resulted in incontinence and an episode that morning of hematuria. She has anxiety too. So this could be a case of UTI as there are complaints of dysuria, urinary frequency. Okay. With this, these are the organisms which are infecting this urinary tract. This is the image showing that. So this urinary tract infections again can be classified into upper urinary tract infections and lower urinary tract infections. So upper urinary tract infections, commonly it's referred to as pyelonephritis, and lower urinary tract infections which include cystitis, urethritis, which is most often sexually transmitted, and prostatitis. So which UTI is more common? Probably the lower UTI, that is lower urinary tract infections, are more common when compared to upper UTI. So what are the features the patient might have? So as we saw in the first history, so there might be frequency, urgency, burning, dysuria, anything can present as the presenting features. And there might not be any fever or costovertebral angle tenderness, typically in case of cystitis. And what is the most common organism causing this is E. coli. So E. coli is the most common organism responsible for causing UTI, and other organisms like your Klebsiella, Proteus can also contribute to the formation of UTI. When Proteus is an organism, again the urine will be alkaline, so the pH will be alkaline due to Proteus. So in young females, again Staphylococcus saprophyticus could be a reason for causing UTI. And in female having dyspareunia, so we have to rule out cervicitis. So we have to rule out a history of catheterization or some obstruction or stricture or tumor before treating UTI. And we have to first do a culture sensitivity before starting an antibiotic. So commonly Septron, that is trimethoprim sulfamethoxazole, is given as a combination, or fluoroquinolone can be given, but these are not advised in case of UTI in pregnancy. So a word about E. coli. So E. coli is a common organism which is commonly found in urinary tract infections. So it's a gram-negative rod. So this man is having a rod. So gram-negative organism. So again it has a, in McConkey it has a pink color appearance. So pink monkey picture is shown here. So pink colonies on McConkey agar. And there are so many types of antigens. So A, K and H antigens are there. So this A antigen which can cause septic shock, and K antigen can cause pneumonia, okay, meningitis. And E. coli is again responsible for food poisoning. It can cause diarrhea too. So this picture highlights your urinary tract infections. So E. coli is a major reason for that. And H antigen which is responsible for motility. So that's why the ant which is moving like picture is shown here. This is a word about E. coli, which is the most organism. So here we can see the picture. So how the infection ascends from the skin or rectum. So it can travel up the urethra, okay, and reach the bladder. So this is again the picture showing how it is seen inside the bladder wall. So the organism attaching, that is it's adherent to the wall, bladder wall. So first what we'll do is we'll go for urine cultures, and especially we'll ask them to collect a midstream urine, so to avoid any contamination, and early morning specimen is advisable, okay. So this is a picture again showing the clinical features. So there might be burning, maturation, and we have here given a picture of elderly female, so who is more common, and female children. So why female population is more common in UTI? who gets UTI is because females they have a females they have a short urethra, and so again there is it's close bladder, again it's close proximity to, and in females because of a short urethra and the urethra is close to vagina and rectum, so they are more prone to get UTI. And here we can see temperature, okay. So the fever might be there, and LOZ, okay. So sometimes in elderly female they can present as loss of consciousness, so delirium they may present like that in elderly, and this shows dehydration. So dehydration, which again precipitate UTI, and she has kept her nose like this, so smelly urine, again cloudy urine. So these are some of the presenting features of UTI. So again men can get after sexual intercourse, so it's better advisable to take a shower and void after sexual act. So input output chart should be monitored. So they are supposed to urinate every 2 to 4 hours. And home remedies like they can take a cranberry juice, and antibiotics should be taken after giving cultural sensitivity, okay. So these are some home tips, that is drink plenty of water, drink cranberry juice, increase vitamin C intake, then avoid spicy foods, alcohol, caffeine and citrus. So now this is the image showing cranberry picture. So what are the drug pharmacological measures? So we can either advise them to take fluoroquinolones, norfloxacin, ciprofloxacin or ofloxacin, or sulfonamides, cotrimoxazole, which is a combination of trimethoprim and sulfamethoxazole, and cephalosporins, especially the first generation cephalosporin like cefalexin, or the third generation cephalosporin like cefpodoxime proxetil, amoxicillin, or urinary antiseptic NITROFURANTOIN. Any of this can be prescribed for the treatment of acute UTI. Again, the patient may be advised to take for 3 to 5 days. So this is the management for acute UTI. We can use either fluoroquinolones or Septron or cephalosporins or penicillin group amoxicillin or urinary antiseptic NITROFURANTOIN. So this is the management for acute UTI for a duration of 3 to 5 days. Then when will you give prophylaxis? Again, for prophylaxis, what are the indications for prophylaxis? When the patient has recurrent attacks of symptomatic UTI, or when there is catheterization, so when an indwelling catheter is placed, or when there is urinary stasis due to obstruction as in case of prostatic enlargement, or when there is abnormalities in the urinary tract which cannot be corrected by surgery. So these are the indications where there is a need for prophylaxis. When there are recurrent attacks of symptomatic UTI, when a catheter is placed there, or in case of prostatic enlargement where there will be stasis of urine, okay. So what are the drugs which are given? Again, Septron, cotrimoxazole. Septron is the trade name, NITROFURANTOIN, which is a urinary antiseptic, norfloxacin, which is a quinolone group, and cefalexin. So these are the drugs recommended for prophylaxis of UTI. And what are the drugs which are contraindicated in renal impairment or not advised and toxic? So this NITROFURANTOIN, again, which is a urinary antiseptic, it should not be given in case of renal impairment. And tetracyclines are also contraindicated in renal impairment except doxycycline. So these drugs should be used on certain cephalosporins like cefalothin. For the drugs to act, again pH is important. So urinary pH is important for certain drugs. The pH needs to be maintained in an acidic way. In case of when we take NITROFURANTOIN, methenamine or tetracyclines, because these drugs can act only in acidic pH. And alkaline pH is needed for drugs like fluoroquinolones, aminoglycosides, cephalosporins and cotrimoxazole. So how to remember these? So this is rhyming like nit, met, tet. So this is acidic pH. So nit, met and tet. And alkaline pH we can remember as forced alkaline diuresis is needed in conditions of certain poisonings. So this F stands for fluoroquinolones, A stands for aminoglycosides, C stands for cephalosporins and another C stands for cotrimoxazole. Forced alkaline diuresis in conditions of certain poisonings. So they need an alkaline pH. So pH is immaterial in case of drugs like your ampicillin and chloramphenicol. So chloramphenicol is not used because of its side effects like bone marrow suppression. It can be used in selected cases of pyelonephritis not responding to other drugs. In case of pyelonephritis not responding to other drugs. Now coming to the urinary antiseptic NITROFURANTOIN. So NITROFURANTOIN is again how its act is, the mechanism is it's reduced to toxic intermediate compounds which again interferes. This toxic intermediate compound interfere with the DNA synthesis. To interfere with the enzymes in DNA, thereby interfere with your protein synthesis. So this is a mechanism for NITROFURANTOIN. So it is again bacteriostatic at lower concentrations and becomes bactericidal at higher concentrations. It acts on both gram positive and certain gram negative bacteria. So E. coli is your gram negative bacteria, and as we said, it's effective only at acidic pH. So what are the adverse effects? Common side effects include it can cause gastric pain. Okay, so GIT, that is GIT disturbance, are the commonest adverse effects. Nausea, vomiting can occur with this. Epigastric pain can also be seen, and urine becomes brown on exposure to air in case of NITROFURANTOIN. And it can also cause peripheral neuritis, which sometimes might be very severe. So all these side effects are taken if occurs in case of when it's taken for longer periods, longer duration. Pulmonary reaction, again it can also cause pulmonary fibrosis on long-term use, and it can also cause hemolysis in case of G6PD deficient patients. So these are the side effects, and again the commonest is your GIT disturbances. So what are the uses and precautions? So as we already saw, it's used for the treatment of acute UTI. It can also be used in prophylaxis of acute UTI. So it can also be used in treatment of acute UTI and prophylaxis of lower urinary tract. It's not at all useful in case of upper UTI because it is concentrated in urine. It is an urinary antiseptic. It's not used in the treatment of upper UTI. Okay, and also it can be used in the prophylaxis of recurrent UTI. And drug interaction, coming to that, probenecid interferes with its renal excretion, so should not be given with probenecid, and is also, as we already discussed, is contraindicated in renal failure. Also in pregnancy it should not be given. So now coming to the another urinary antiseptic, that is your methenamine. Methenamine also needs an acidic pH because it decomposes in acidic urine and releases formaldehyde which kills the bacteria. So acidic urine is must for its action. So it's only used for prophylaxis of resistant or chronic UTI. It's not at all useful in acute UTI. So it's not at all used for acute UTI. It's only used for prophylaxis. So what is the adverse drug reaction? It can cause, similar to your NITROFURANTOIN, it can also cause gastritis. It can also cause chemical cystitis and hematuria in long-term use, and it should not be given in case of renal impairment. So this is another urinary analgesic. This doesn't have any antibacterial properties, just an analgesic. It's mainly used for relief in burning sensation and in case of urgency. So it's nothing but an orange dye. It's an analgesic. It has no antibacterial property. Phenazopyridine. So this is a case history of 1.5-year-old baby who came with history of frequent dribbling of urine. Also, she had frequent passage of semi-solid stools, but she was diagnosed to have an acute gastroenteritis. So the pediatrician advised her advised their parents to do a urine culture and sensitivity, and they asked them to give zinc drops and enterogermina, which is a probiotic, and if vomiting is there, they asked to start up with syrup vomiting. So on giving urine routine, it was found to have, the urine routine showed, so here we can see the pH is acidic, okay. And what happened to the pus cells? It was around 20 to 25. So this could be a case of UTI. So before we get the culture report, first we will get the urine routine report. So from that we can get a confirmation of UTI. So this is definitely a case of lower UTI. So culture report will come after 48 hours. So the next day, the pediatrician confirmed it as a lower UTI, and she was started with syrup Septron and syrup Citralca. Septron is nothing but cotrimoxazole. Citralca, which is an urinary alkalinizer. She was started on that, and next day, that is after 48 hours, the cultural report came, and here we could see what are the antibiotics which were tested. So your aminoglycosides, amikacin, gentamicin. This is your fluoroquinolone group, ciprofloxacin. This is your beta-lactam groups, imipenem, meropenem, amoxiclavulanic acid, piperacillin, tazobactam, and this is your cephalosporins group, cefepime and cefixime, and ceftriaxone, and tigecycline, which is a tetracycline group, colistin, which is a polypeptide antibiotic, nitrofurantoin, which is a urinary antiseptic, and Septron, sulfonamide groups. So these drugs were tested, and it was found to be sensitive only for meropenem, piptas, that is piperacillin, tazobactam, tigecycline, colistin, and nitrofurantoin. So for all others, it was given as resistant. So the baby was given on Septron. So Septron, again, here it showed resistant. So you need to change the antibiotic. So among this, which can be preferred? So here the baby was treated with nitrofurantoin because it is a cheap drug and it can be given orally. Whereas your meropenem, tigecycline, so these ceftriaxone, all ceftriaxone is resistant here. Tigecycline, all these need to be given parenterally. So we have to choose a drug which is economical at the same time. An easiest route, so oral route. So nitrofurantoin is given for the child and treated for 1 week. So the dose is 100 mg for adults, TDS, which is given, and in children it is 5 to 7 mg per kg per day. 5 to 7 mg per kg per day. So the baby weight was around 10 kg. So she was advised to take 50 mg per day. So a 100 milligram tablet was taken. So nitrofurantoin is available as both 550 and 100 milligram tablet strengths. So she was advised to take 50 milligram per day only. So the tablet was she was given 50 milligram tablet, and it was split into 3 parts and dissolved in water, and the baby was asked to consume that, and she was treated effectively with a cheaper and also the same way an effective drug. So repeat urine was taken after 10 days and it showed no growth. So this is the way to treat a patient with a UTI, and this is a case history of my own kid. And this is yet another history. A 36-year-old female who came to the hospital for having high-grade fever. Temperature was 104. She was done a cesarean section 1 week before. The obstetrician, after examination, gave her linezolid antibiotic. She was advised to do urine culture and sensitivity even though there are no symptoms of UTI. Even after 2 days, fever didn't subsided. And she also had another complaint of not able to eat anything. She visited again the hospital again. The doctor asked to collect urine culture sensitivity report. So what could be the case here? Again, only clue was fever. But the obstetrician examined her. So what is the thing to be suspected? The commonest is here puerperal sepsis. So again it was ruled out. So the doctor again examined her thoroughly. There was no wound infection. So no pus discharge or something else. Nothing was there. But only fever. So it could present in an unusual way. So again the cultural report came and it was found to be a urinary tract infection. Okay, and the organism found was E. coli. So why linezolid didn't act on that? So what is the reason behind that? So what is linezolid, which is an oxazolidinedione? So how does it act? It inhibits protein synthesis by binding to 50S ribosomal unit, and where it's given is given for multi-drug resistant gram-positive bacteria. Since the obstetrician wanted to give a higher antibiotic again at the same time because after a cesarean section, so sepsis is more common. So we should first treat that. So by suspicion only she gave linezolid, because it's very effective for multi-drug resistant gram-positive bacteria, even your methicillin resistant Staph aureus infections, vancomycin resistant enterococcal infections, And also for nosocomial and community occurred pneumonia, which is caused by Staph aureus, and penicillin sensitive streptopneumoniae and penicillin resistant streptopyogenes. So these is a reserved drug for highly resistant infections. Also is given for pediatric use and diabetic foot infections. So why this? So adverse effects, it can also cause reversible thrombocytopenia, neutropenia, and reversible optic neuropathy is common if taken for more than 6 weeks. And another complaint that that person, that is the patient, said that she was not able to eat anything because this causes taste alteration. So she couldn't perceive any taste. So that was the reason she was not able to eat anything. Taste alteration was there. Because linezolid causes taste disturbances. Even it might cause oral candidiasis. Okay. And drug interactions, again it can cause cheese reactions. And if used with selective serotonin inhibitors, it can cause serotonin syndrome. So how to remember this linezolid? So L stands for lack of activity, INE stands for in gram-negative organisms, linezolid, O stands for oral, that is taste disturbances, lid, so something related with eye. So optic neuropathy if taken for more than 6 weeks. Thank you.